We're back, and the topic today, of course, young people in crisis. We're talking about mental crisis, and we have a couple of folk on board that we've been talking with, Dr. Whiting-Madison, who is with us, and Dr. Lori O'Malley, both psychology and sociology instructors, assistant professors, in fact, at Rogers State University. Now, let's start with a person who is not trained. And the way I want to do this, I don't want to have to direct a question to one or the other. I would like for both of you to join the conversation. So if I ask a question of you, I'd like to get a response from both of you, if we could. We're dealing with young people in crisis. We are, for the sake of discussion, untrained, but we recognize that something is wrong. And you have already given me some of the things to watch for. Let's say, just for the sake of discussion, I know what things to watch for, and I think this person has a problem. What do I do?
I really feel strongly that you always need to speak up. I think so many people, especially those that aren't trained in our field, are so afraid of saying something that's going to, plant a seed. They're afraid that if they say, hey, are you suicidal, that's going to plant the seed of being suicidal in them. Research suggests that is never the case, right? I mean, the worst case scenario, they're going to say, no, why would you think that? But we're so afraid to offer help. We're afraid to get involved. We're afraid of making the situation worse. But really, all you're doing is showing that you care. You're showing compassion. You're showing understanding. The best thing you can do is speak up, reach out. And if you don't know the next step, offer to take them to the next step. Hey, look, let's find a therapist together for you. Let's find a psychologist or a psychiatrist for you. Hey, didn't you have that psychology professor that you really liked? Let's go find them and see if they know any resources. Just don't be afraid to say something.
Let me interrupt you right there.
Sure.
If this young person's frontal brain, has not developed, not matured enough, won't that youngster reject that offer of help?
Sometimes that happens. I don't necessarily know that it is a reflection of their prefrontal cortex or that reptilian brain. I think that people sometimes are just hesitant to seek help because maybe they think that people will just tell me I'm crazy, or something bad would happen, or they're going to call my parents, like in the case of a student, a high school student, middle school student, college student, that other people are going to have to get involved. But I think Dr. Whiting is correct, and we have these posters around campus, and if you see something, say something. And that's kind of one of the mottos here on our campus, is that if someone is behaving differently than you know them to, then say something to them about it. You're not going to give them the idea to do anything unless you tell them. Like, they may be unaware of counseling services that are available. They may be unaware that everyone else is noticing what's happening to them. They may think they're hiding it really well, and they're not hiding it from anyone. So I think that idea of, hey, say something to the person is particularly important. And as she just said, too, that you're showing that you care about the person. So it's more of a, I care about you and I'm here to help you, whatever that looks like. And sometimes we have roommates or a situation like that where, especially with the pandemic that we've had, where people have become much more isolated. And then we now are dealing with going back out in public, and maybe we're super hesitant to do that. Or we've gotten so used to being so isolated that we've developed a kind of strange comfort with it. And so we will keep ourselves isolated when we no longer need to. And it can become a negative coping strategy. Well, maybe we need to take that person to breakfast. Maybe we need to take them on a walk with us. Maybe we need to just kind of help in that way of breaking that cycle and then figuring out more about the process. But I also really think that she touched on a great point of know the resources, know where there are counseling centers or national hotlines, and be able to Google those numbers. And at the very least, you could Google a number like that and sit and make the call with someone. And so they don't feel alone and don't feel like, they're yet again having to do something else alone and by themselves.
Let's move to a different set of figures and facts here now. Let's move into the trained individual who might spot someone outside the classroom or outside a private therapy session who is in crisis and who has yet to admit it to themselves. How does a professional deal with that?
Well, Dr. Whiting has already mentioned she has people in her classes who would write some papers and she notices it. More often, I get students in crisis that will just show up in my office. Even though being a therapist is not my role at RSU, I'm a faculty member, a researcher, I provide service to the community, but I'm not a therapist here. But I am a licensed therapist, so they know that, and they'll come to me because they've seen me in class and already developed a relationship with them. So I may talk to them for a few minutes and then pull out those resources. And well, it sounds like you could really benefit from some counseling. Let's get connected with the person here. Or do you have a counselor that you worked with back home? And when are you going to go back home? And is it possible that you could see that person again? Or let's find some other resources and just get you someone, a professional to talk to, right? And it's a hard hat to wear, It's a hard hat to wear when you have the skill set and you have the experience, but it's not in your role to take on that identity with a student. Right, so it's even more important then that the student still feels supported and still feels appreciated and feels like you care, which you do, but we're guiding them to get a more appropriate resource developed.
There are so many, I won't say problems, but there are so many situations that can trigger behavioral changes. Poor diet, trouble at home, parents who are all of a sudden in the middle of a divorce, parents who fight constantly, parents who disagree all the time over little petty things. All of these things will have an influence on a youngster whose hormones are jumping around like jelly beans. How do you differentiate between a child in crisis and a child facing external problems that has them exhibiting what appears to be a crisis?
Well, sometimes you really don't even have to differentiate those. I mean, for me, both of those reflect as someone that still needs someone to show them kindness and compassion and someone to listen. So, we live in a society where people have been conditioned to believe that counseling is just for when you're mentally ill, for when you want to kill yourself or hurt someone else. But that's just not true. Counseling is for everyone. If you just need a sounding board, if you're trying to make a difficult decision, and yes, those people that have serious emotional issues as well, but it's always a good idea. Every time somebody says, well, I'm seeing a therapist, I'm like, yay, everybody should go to therapy. It's great for everyone. You don't need to be on the end of a rapidly fraying rope for it to be a good choice.
Wholeheartedly agree with that statement. The other thing I think that is important to keep in mind is that we all tend to think that our problems are the worst problems on earth and someone else's problems are not as big as mine. So the fact that, we have differing levels of behavior changes or differing sources of problems in a person's life, maybe it is my parents are now getting divorced after they raised me and I'm out of the home, so now they've chosen this is the great time to do that, and that is my crisis. And that is a true crisis to that person. So I think it's, again, about not saying, well, that problem isn't as important as this problem over here with another person. They're all the most important problems for that individual. And I think that's an important thing for us to remember.
Let me take you down a slippery slope here.
Okay, I like those.
All right. Let's talk about Christmas and Thanksgiving.
Oh, yeah.
Or at a time when traditionally families might come together to enjoy a meal, and all of a sudden you recognize that Aunt Thelma might be there might be just a brick or two missing. And I'll give you an example. My brother lives in Arkansas, which is already against him, but at the same time he likes to count fence posts
Yeah.
when we go fishing. And so I have just recommended him for all kinds of treatment. What do you do when it's a relative? How is the approach different?
I think when you go home for, like, a college student going home or someone who is visiting home and has a short amount of time with those relatives, I don't know if you exactly have enough time to look at behavior changes. And you certainly, I mean, we don't want to get in the habit of telling people to analyze their family and friends. That's a very dangerous thing, and some of our students will go to that. Once they take intro to psych and abnormal psych, they'll be labeling people left and right because, oh, I learned about this in a class. So we really want to avoid that practice. But you do notice things when you go home, and it is striking sometimes because you left in the fall, maybe as a typical college student, or you left to go back to work, whatever time frame it was, and you haven't seen that person for months on end and probably haven't necessarily kept in close contact with them anyway. And then you all of a sudden show up at a holiday and things are very different. But the people who are around that person have probably noticed it too. It's just been an incremental
Right.
decrease or increase in a certain behavior.
Right, and and I completely agree with you. I think that when you're seeing people at Thanksgiving, Christmas, those 2 times a year when everyone's together, you may see things that are alarming. But I promise that the family that's actually living with that family member is seeing more than you are. So for me, I think I might express my concern more to that family member who is seeing the progression and say, hey, taking off my family hat right now, putting on my PhD hat, and seeing this, you might want to watch that. This looks, a little bit like the start of dementia, maybe make a doctor's appointment. But at the same time, you do really want to watch diagnosing everyone. I try very hard to make it a habit to not diagnose my family and friends, even if it's really obvious. And I have in my head, but we still try not to do that.
I hate to do this. We got 20 seconds. I'm going to use it to thank you both for taking the time away from your busy schedules to visit with us. And I would like to have you back down the road if that's possible. Can we do that?
Would love
Absolutely.
that. Absolutely.
Be great.
Great. Hey, thanks to both of you. Enjoy out there. Wear a mask. And we'll see you folks at home